Hello everyone and welcome to this special webcast brought to you by the Conference Board in partnership with Bowie Health. I'm Amy Yi, researcher here at the Conference Board, and it's a pleasure to welcome you all to today's program, Speaking from Experience, Return to Workplace Strategies at Work. As we all know that federal and local governments start to lift restrictions related to COVID-19 and more business begin to reopen, so many organizations are working really hard on designing and executing a reopening strategy that can bring employees back to the workplace safely. So in today's webcast, we will hear from leaders from different companies and industries share their challenges, opportunities, and lessons learned about reopening workplaces. So here are a few questions we'll be discussing today. And the first is around organizational responses to the pandemic. So how is each organization adapting during COVID-19? What have they been doing, and where do they currently stand with reopening? And the second is around trust. As we all know that COVID-19 has brought organizations with a lot of changes and uncertainty, so trust is more important than ever to help organizations recover quickly. So our speakers today will talk about how their organizations build and maintain employee trust and handle employee communications during this challenging time. And next is around the importance of data-driven decisions in response to the changing business and employee needs. And also as more organizations embrace work flexibility and remote working, and how to support a hybrid workplace that consists of both remote employees and those who work in person is another topic we'll be addressing today. And last but not least, we will discuss what the new normal will look like. So before we address these questions, I'd like to first go over a few details about how you can best participate in today's webcast. First, today's webcast will be a panel discussion, so I really encourage you to actively engage in the conversation by sharing your questions and comments in the chat box. We will save some time at the end for our speakers to address your questions. And you can also download the slides, and the link is at the bottom of your screen. And to make the screen larger, you can click on the 4 arrows at the top right-hand corner of your screen. There will also be a brief evaluation at the end of today's webcast, and we would greatly appreciate your feedback. And please note that the webcast will also be made available on demand on the Conference Board website shortly after today's live session. For those of you who are seeking CEU credits, please note that the credits are only available for those who attend the entire live show. Please type your name, email address, and credit type in the space provided below. If you wish to earn CPE credits, please also check the 3 pop-up boxes that will appear throughout the program. Now I'd like to introduce our speakers today. So we have 4 speakers. The first one is Sandy Mana, who is the Director of Customer Success at Bowie Health. So Bowie Health is a Boston-based digital health company that uses artificial intelligence to help consumers self-diagnose and also navigate to appropriate care. Sandy is responsible for leading Bowie's customer success strategy across its product portfolio to help customers drive down costs and also improve quality of care for all. We also have Sean Hoagland, who is the Director of Compensation and Benefits for Potlatch Delta Corporation, a diversified forest products company. He has been with the company for 12 years. Sean's also a strong supporter of secondary education and granting access to non-traditional students. He currently serves on the board of Eastern Washington University Foundation and as a board treasurer of Spokane Community Colleges Foundation. Next one is Dr. Louise Short. Louise is the national clinical leader for Brown & Brown, one of the largest independent insurance brokerage firms in the nation. So she founded and runs Innovation Hub at Brown & Brown, which is focused on application of digital health and other innovation solutions to improve health outcomes and healthcare costs, as well as improving human performance. Last but not least, we have Jackie Ward, who is the Chief HR Officer at Newport Group, a top independent retirement and benefits provider. She is currently leading Newport's employee response to the COVID pandemic. Jackie has nearly 30 years of global HR management experience spanning the financial services and high-tech industries. So a big welcome to all of our speakers. I'm very looking forward to today's panel discussion. Without further ado, I will hand it over to Sandy to get started. Sandy, the floor is yours.
Thank you so much, Amy, and thank you, panelists, and thank you for everyone who's attending. We're really excited to dive into the material today because, as you know, the difficulties of understanding, deciding, and building out return-to-work strategies, there are no limits to them. We have a panel list here of experts across industries who have navigated these challenges and are here to share their real learnings. Again, my name is Sandy Uemana. I lead the customer success team at Bowie Health and have had the amazing opportunity of either personally working with these employers, knowing them personally, or through my team being able to work with them as they've shaped these strategies. So I'm excited to just spend some time here with all of you and really get down into what I hope can be tangible next steps, tangible learnings, so that this is not only kind of educational, but truly something that you can apply as you move forward. And so then, just to get going and get started, we wanted to first level set. And here with this first question, Jackie, I'll have you actually go first. How has your organization adapted to the pandemic? Where do you currently stand with reopening? Jackie.
Great, thanks, Sandy. I think it's fair to say that we were definitely in denial in March when we all had to suddenly retreat. We adapted very, very quickly. Newport Group is in the financial services business, and so classed as an essential business, we are officially able to stay open and keep all our offices open. We have about 25 offices in 20 different states across the US, and not every office has HR or an official site leader, so it's quite difficult to know how do we stay on top of everything going on in each of those sites. Also, as a financial services provider, security of client information was very, very key to us. So we were very used to being in the office organization. So suddenly retreating to remote working was definitely an adjustment for us. But everybody adapted really, really well. We have now about 94% of our people are working remotely still. We only have about 6% going into our offices either on a full-time or a part-time basis. And pre-COVID, we weren't an organization that was using a lot of cutting-edge technology, so our people have had to really adapt to using video and getting scripts with soft phone technology and all those kinds of things. But people have really embraced it, and people are doing really well, and productivity has stayed very high. Where we are right now is that we expect to continue working as we are in this remote type situation and a hybrid type situation for quite some time to come, maybe even through most of 2021 until there is a vaccine available. Our stance is very much that we only want people in the office where they're comfortable being in the office and where they want to be in the office.
Great. Thank you so much, Jackie, and for specifically highlighting not just the challenges of transitioning. I think the statement that you made around the shock of that moment of having to kind of retreat rings true really across, I'll say, for my own company. And so I really appreciate you calling that out. Sean, would love to go over to you as you have kind of navigated PotlatchDeltic. How have you adapted? Where do you find yourself today?
Yeah, thank you. So similar to what Jackie was describing, I think we were in denial at the beginning of the introduction of COVID as well, and resistant. We have a pretty traditional company, resistant to working remotely, and our hands were forced. We're an essential business, and so we had to continue to perform and do that without missing a beat. And so while there was a lot of nervousness about sending people home, at least support personnel home, we a lot of the equipment that was necessary we already had in place, so the execution was simple, but managing remotely was a new challenge for us, and I'd say most of the focus was on communicating professionally, but also personally to make sure that we were monitoring with our employees, how are they doing. Similar to everybody else in the country, you got parents are now teaching and they're trying to fill their professional roles, and they're getting stretched, and really monitoring that pressure on them was a priority of ours.
Fantastic. And John, where does PotlatchDeltic kind of currently find itself in the process of reopening?
Yeah, for our corporate offices, the offices are open. We're not required to be in person. They're open, and you can return voluntarily. We have about 10% of our personnel that have chosen to go into the office every day, whether that, and that could be for numerous reasons. Either they don't have adequate connectivity at home, they're checking, physical mail, or we've got some families where they got a lot of kids, and it's almost impossible where it's impossible for them to be productive at home, so they're alternating with their spouse about who's working from home and helping with their child care versus those that are going into the office. There's a lot of speculation about, when will we get back and when will everybody be back in the office? And I think, the rules just continue to change. And, what we know about the COVID is evolving, and the expectation about returning to the office, that speculation has changed. Even from our leadership, they've been really receptive about the fact that, gosh, we don't really know when we're going to return at this point. There's lots of speculation about the timing of vaccines that would influence us, but really, I think in light of you look back and you reflect on the fear that we had of working remotely, and the fear of managing from afar, and we didn't miss a beat. In fact, I would venture to describe that our productivity has improved. And that has, I think, changed our culture for the better. And I think our leadership has kind of taken an approach that this could potentially, working remotely, could be a potential component of our future in forever. And I don't know exactly what that looks like yet. That's still evolving, but our eyes have been opened.
Great. And Louise, thinking about Brown & Brown at scale, how has Brown & Brown adapted for the pandemic, and where do you currently stand?
Yeah, so, as Amy mentioned, we're the 5th largest independent insurance brokerage in the nation, and we have about 10,500 teammates, over 300 offices around the country. So there were a few things that we really had to address immediately. The first was exactly what Jackie and Sean have been talking about, which is moving to remote work, and that was one of our biggest challenges. So we had to move 99% of our workforce to a remote environment within days, and our IT team did an amazing job. But our culture is similar in that to what Sean has said, in that we've traditionally kind of frowned upon remote work and work from home arrangements, and we had a strong office corporate culture. But it's interesting because we've been very successful with remote work, and we've never closed our offices. We don't refer to reopening. We talk about return to the workplace, because we've been working the whole time, and we've been working very hard to help our clients and our carrier partners respond to the pandemic. So we're careful about that. But we based our strategy really on 3 premises. One is personal responsibility. The second is adherence to guidelines, so CDC, local and state guidelines, and practical and effective measures that improve the health and wellness of the office environment. So we put together a task force that includes our CHRO, myself, legal, and a couple of other business leaders. And we are right now in our stage 1 of our return to the workplace plan. And under that stage, we allow a maximum of 33% of the headcount of any office to return to on-site work if it's permitted by state and local mandates. That's always what trumps our decisions. We always go by state and local mandates. We look at the data, and we'll talk more about data later, but daily, if not weekly, if not daily. And we've reopened offices in 36 states. We have a limited reopening in other states where the data is not necessarily meeting our reopening criteria, but there are teammates that, as Sean mentioned, they've got to go in for other reasons. They're having difficulty working at home. They have other kids, a lot of kids. They have mental health challenges, or they don't have adequate bandwidth, or whatever it is, and so we felt we needed to accommodate them. So at this point, we've got about 2,700 that have returned to on-site work out of the 10,500. Now, in terms of the state and local orders, since we initiated this stage 1 of return to the workplace, Michigan and Minnesota have both issued executive orders anyone who can work remote must do so. So that's an example of where we've had to go by state and local orders. But that's sort of our logic and how we're approaching it and where we are at this stage.
Great. Great. And I think even just as you three have discussed what reopening has looked like, some common themes and kind of the one that really drives the next question has been around how are you maintaining good relationships with your employees throughout this process of moving over to remote work. So Sean, I mean, you highlighted this kind of at the very first thing, as you said, as people were resistant to remote work. How are you transitioning them and building that employee trust? And what has been the process of maintaining employee trust been throughout this process?
Yeah, when I think about the resistance to work remotely, it wasn't coming from the staff. They were anxious to work remotely. It was really coming from our leadership, and to allow for it. Well, first of all, our hands were being forced. That was a big piece of it. But to get their buy-in, this may be unorthodox, but I really looked to see who our leadership's relationships were locally and regionally, and reached out to my colleagues there to figure out what they were doing, so that I understood: are we going to do something that's outside the box? Are we going to do something that's going to fall in line with their colleagues and their friends, other CEOs? So that helped. But really, when we introduced this, we engaged the employees directly and described, listen, we don't have all the answers. I don't think anybody does. Every time you watch the news, there's contradictions and things are evolving, and we're not going to try to describe that we're experts, because we're not. But we partnered with those regionally companies that we respected, and as the information that we had changed, we shared that with our employees. We still do that. It's ongoing. We describe why we're changing our processes and what those processes are, and we ask for feedback. And that, we're a company of less than 2,000, so that's manageable. I think, if I was in Louise's shoes and I got 10,000 employees all over the country, that maybe is an approach that I can't take, or I've got to get some layers in there to manage that. But it was achievable. It was reasonable for us, and a lot of people weren't pushing back. I think when we were brainstorming about the approach we were going to take, I purposely reached out to some employees that I thought were the most fearful, and I asked them what they thought of our approach, what our strategy was, and really they were very receptive. We were asking for them to do some screenings before they were into the office, and I described that that it's a gray area. People were potentially treading on some personal information, and our intent was not to learn something about them, but really to provide some assurances to them that if they needed to come back to the office, that they understood that we were doing all we could to protect them. And so I didn't, I was preparing for the worst, and it was really it's been a great experience so far.
That's great. And I think the tee up to Louise makes sense here, as you have had to navigate preserving and kind of maintaining that employee trust across the thousands of employees at Brown & Brown. Louise, what have you found to be successful?
Yeah, well, it's interesting because it's been very clearly communicated that teammate health and the health of their family comes first. And so our CEO, Powell Brown, always says the most important thing is your own health, the health of your family, and then Brown & Brown. And so that's been the foundation of how we've approached every opportunity and challenge since the beginning of COVID. We're in an interesting position because not only are we dealing with our own 10,500 teammates, but we are actually consultants and advisors to other employers on COVID. So we've helped our many, many clients in their response and their return to workplace. We put out a toolkit, and I personally have worked with several employers on this. So we've had a pretty aggressive approach in our own company. We almost immediately got a cross-functional team in place, and we put together a robust communication strategy, and I think that was really important, as well as a risk management strategy. And that cross-functional team, I see some questions in the chat about who's making the decisions. We have one cross-functional team that includes risk, legal, business leaders, communications, medical, myself, and others. And then we have a smaller one that's run by our CHRO that includes, again, me, legal, and a couple of others. And we're the ones who are really making the policies for our own teammates. Our larger group is really monitoring the pandemic, and we are pushing out, discussing some things about our teammates, but pushing out a lot of information for our clients. So, you know, we really feel like communications are really, really important. And what we've done is we've had a weekly check-in from the CEO. So Paul Brown has had a weekly webcast, which has been really, really important. We formed a remote workforce, a remote operations task force, where we put a lot of emphasis on supporting employees and a lot of different types of programming. We've got teammate training on how to navigate business in a virtual environment, because that's been really hard. You know, how do you sell in a virtual environment? And we've got dedicated resources on our webpage. We've got a return to the workplace task force. So a lot of that type of communication has gone on, and we've pushed that down to a local level. In addition, our return to the workplace task force has put a lot of policies and procedures in place. For example, we have a standard operating protocol if you have a COVID positive case or a suspected COVID positive case in your office. And so that's been really important. I've actually shared that with a lot of our clients as a best practice. And we put together this toolkit for our own teammates and office leaders, we call them profit center leaders, that really has very specific guidelines on mandatory masks. Is something, you know, we're iterative. We just put into place. We had suggested masks, now mandatory. We've got a contract with an office cleaning solution called Fresh Start, where we've provided that to all our offices. And we've got FAQs for office leaders and teammates. So that's sort of how we've tried to keep that trust up, as well as our live streams that we do weekly, initially and now bi-weekly, that both our teammates and our clients.
I'm not sure if we just lost Louise.
And the other piece of it is providing.
Okay, I think Louise might just be getting in. We might be losing you, Louise.
So we have implemented or are in the process of implementing buoy, and we feel like that.
Okay, Louise, I think we now have you. We lost you for a little bit there, but I think that your main points around kind of building out that robust communication system was really well received. And I think, Jackie, just to end here with you on the employee trust, I mean, I know that communication is always really top of mind when you're thinking about Newport Group. Would love to hear kind of where you would add in terms of how you've been approaching employee trust.
Yeah, no, it's definitely about communication and over-communication, as everybody's been saying. And, you know, we have a business continuity planning team, and that came into place for our COVID. And we were meeting 3 times a week and now meeting 2 times a week. And it just naturally fell that I became the leader for the COVID project because it was so employee-focused and people were asking so many questions. But communication has been key. So like some of the other panelists have mentioned, we developed a special section on our intranet where we had everything from, you know, what to do if you can't log on to your VPN to, you know, providing support for people who needed childcare, or making sure that mental health was doing okay. Our CEO stepped up the frequency of town hall meetings to talk about how the business was doing. And I started doing a weekly email on Fridays, and I thought it would only be for the first few critical weeks, but it's actually become a really key center stone of everything that we have, and people really look forward to Jackie's weekly email, and I use it to be very transparent about what we're doing, sharing the percentages of people that are in the office, where we are on our plan, how many people may have been exposed or are sick within the organisation, as well as pushing out and reminding people about the resources that we have, and also just having a bit of fun and trying to keep some connectedness with making people smile. And then we've also done a couple of surveys through to the feedback platform that we use, Reflective, and they have a coronavirus sentiment survey, and we found that really useful. We did one right at the beginning of March, and we did one again towards the end of July, and that gave us a good sense of the strains and struggles that people were feeling. And a lot of the feedback told us that clearly, people, working parents, a lot of distractions there, people who just didn't have good home setups to work remotely. And so that has really told us that trying to keep offices open and safe for people who want to be in the office has been key, and that's really where our focus has been.
Great. And even just as you all have discussed kind of the communication that has been really necessary in order to maintain employee trust, I think something that everyone is top of mind about is there is an influx of a ton of data. And it seems like there's new legislation coming out, there are new executive orders, there's kind of new information coming through that may affect your decision making. So as we go into this next question, and Jackie, I actually would love to start with you. What data has been most essential as you've been making decisions for Newport Group?
Yeah. A lot of it has been that regional data, and we've been reliant on people around our office network often giving us the latest guidelines that have come out. But also the legal firm that we use have got a very good daily summary, and so we've relied on that. Data as well, just coming back from our people. So a lot of our decision making has been based around the comfort levels of our people. And even though our people are spread across 20 different states, and as we know, the different states have reacted very differently to COVID, we found that our people's sentiment has been very much the same, that people are scared of being in the office and people want to be remote. So we've taken very careful note of that. But what's also been very important for us is in setting out our plans for being safe in coming back to the office. Again, I think as Sean mentioned, we have set levels of a minimum and maximum number of people that we will allow in at any stage of going into the office. And so we've been reliant on both the buoy data of using for health assessment, but also using the office access systems. HR didn't have access to that before, IT has given us access, and so we go in and track daily and look at what are the percentages of people coming in, and we share that with the business continuity team and make sure that we're within the quotas that we've set for ourselves.
Great. Louise, would love to get your flavor on kind of how data has figured into your decision making as well.
Yeah, so we've tried to really make data-driven decisions and also use, as Jackie was talking about, employee sentiment and feedback, so we've had our own surveys as well. The data sources have really evolved over the course of the pandemic. So, some of the ones that we look at and pull different metrics from include the Johns Hopkins database, RT Live, which we've been following that carefully. It kind of shows the transmission rate by state and also shows the 14-day trends in new cases. We've pulled some data from CDC. COVID exit strategy has a great website that has a number of different parameters, including number of cases per 100,000, the percent positivity, and the amount of testing in different states. So that's been good. There's a COVID decision website that we've been using that you can actually drill down by county. That's been helpful. And then also referring to state health department websites, particularly for information like what are the quarantine rules for employees that might be traveling either on a personal basis or on a business travel. Right now we are pretty much saying only very essential business travel, but we still need to keep up on the quarantine laws. Other sources we've been using include the Kaiser Foundation website. That has a great database to monitor state and local orders and quarantine status. And then we've also are hitting some of the legal group websites, as Jackie mentioned. They're tracking a lot of these laws. So those are some of the databases that we've been using, as well as our own employee sensing website. I think what's interesting is the data is evolving and the sources are evolving, and so we try to keep up with it all and make sure that we are very clear on what our thresholds are for allowing offices to open. And we also send alerts. So we might say, okay, an office can open, and then it turns out that the cases go up or the percent positivity goes up in that area. We
and
send
Sean,
an
I know
alert
that you
to those
can
office
commiserate with
leaders
kind of
saying,
the
"Hey, we allowed
moving
you to
target
open,
that is the latest
but in fact, the
information.
data has
How is
changed,
Potlatch
and
Delta
you may want to reconsider
this?
what you're doing." So just important to keep on top of everything,
Sean, you
because
might be
this
on
is
mute.
a moving target, on a daily, if not weekly basis.
Perfect.
Our approach has changed quite a bit. Similar to the resources Louise was talking about the quarantine rules, we've followed those and monitored them pretty closely. And we've got some partners. We've got some consulting partners that we're talking with on a weekly basis just to make sure that we're not missing anything. Other than that, really the data has changed. When we first started kind of handling COVID, we were really interested in the number of positive cases and hospitalizations in each of the areas of the country that we do business. I think that has subsided, and now we're really focused on the business and the personnel at each of our locations, and just realizing we can't control what's going on in these cities and counties that we're doing business. So really, what's the number of symptoms that our employees are experiencing at each of the locations? How many people have been tested? How many people are out currently? Those are what we're monitoring more closely now. Not that the phase, level of phases at each of these counties, it is important, but since we're an essential company, we got to keep up. We got to keep open and moving forward. And so, to reduce the noise, we're really just focusing on the experience of our employees.
I think, and I find it helpful just to, after each of these questions, just like pull together some of the major themes, because I know that there's a breadth of information that you all have provided. The fact that you've kind of pulled together these different data sources, I think, Louise, you highlighted a few that you found to be like really helpful, and then you're making these key decisions and maintaining flexibility as you go through is, I think, one of the major takeaways. Working with all of you and kind of hearing how you all have worked with members of my team, I think maintaining that flexibility and being able to adapt as new information comes through is really one of the major keys to your strategies. So thank you for highlighting that. As we get into this next question, which is really around something that all of you have touched upon, which is really how are you supporting the fact that for many of you, you have people who may still be working remotely as well as those who are coming into the office. What is the process of supporting your workforce across both of those two different realms? Louise, I'd love to actually turn it to you first as you think about maintaining relationships, supporting your workforce for those who are coming in and those who are not.
Yeah, so it's so essential. I mean, as I said, we're focused number one on teammate health because we know that in our business of, really insurance brokerage and consulting, it's professional services, all about the people, right? So our CEO is a big champion of what he calls brain health, and even before this pandemic started, he did a bike ride across America to raise money for a psychiatric facility in Georgia, and in his weekly video messages throughout the pandemic, he always speaks of brain health and exercise as being critical areas to pay attention to and for everyone to engage in. And we know there are many fears and stressors right now, including, getting sick, having a loved one get sick, loss of a loved one. People have suffered losses. They're dealing with elderly parents, kids at home, possible income loss. So there's really a behavioral health pandemic here that I think is going to last a lot longer than the COVID-19 pandemic. So we've put a number of initiatives in place really to support our teammates no matter where they're working, whether it be back in the office or remote. And I'll talk about the back in the office controls I mean, to really make sure that the workplace is safe, we've put in, mandatory masks, office cleaning with Fresh Start, as I mentioned. We've put in social distancing by, cutting down the number of people that are in there. We're implementing GUI. We've put travel guidelines in place. So we've done all those things for people that are in the office or in the field, because we have a lot of people that travel to clients. But in addition, for everyone, we've put something together called Cup of Joel. So our behavioral health leader's name is Joel Axler. He's a psychiatrist. And he kind of does just a weekly kind of, I won't call it a group therapy, but a group chat. A lot of people dial in and they talk about issues that they're dealing with. We have something called Small Bites that's, just sort of little bites of information on health and wellness. It might be meditation, yoga, other kinds of things. We have Small Bites Junior, which is programming for kids, where we've had people doing art projects and, teammates who are kind of using their skills to be on these and help other teammates. We've promoted our EAP resources, put in place some other tools for coping and stress. We're looking at digital tools for behavioral health, and we've actually implemented one of them through our carrier.
Breadth of different types of services that you've really invested in to support people while they're home as well as while they're in the office is fantastic.
All around, we're
Sean, maybe to go to you next, how has Potluck Deltec really approached
this? A lot in place already.
Yeah, similar to Louise, I think we must have been playing from a similar playbook here. We leveraged the telehealth providers that we had, and we promoted that really aggressively. The utilization of that for pre-COVID was pretty low, and if you look at that utilization on a graph, it looks like a hockey stick. I mean, it took off like a rocket, and employees are raging about it. In fact, we went from one provider and we've expanded it to 3 providers, because I think, I'm sure Louise and Jackie can probably attest to this, but the rest of the country is using it too, and there were times where it was difficult for employees to get through to care quickly. I think pre-COVID you signed up for one of these telehealth providers and you engaged it, and you'd be face to face with a doctor in a couple minutes. There were cases we heard where this would take half an hour or up to an hour to get care, and so we've expanded those offerings. We leverage the EAP pretty heavily, knowing that employees are not going to come forward with some questions or concerns or issues that they have. So we've leveraged the EAP. And then really, we had weekly meetings with HR leadership that we have across the country, really talking about what they're seeing. And that helped a lot across our companies. It helped open up the eyes of our leadership of things to be looking for. Not only trouble, with regards to screenings or people, afraid and wanting to stay home, all the way through mental health, how to identify stress. We really started becoming more proactive than we ever have in that space. So those are kind of some of the things that we did on a personal level for employees. I think one additional piece is that we were really trying to be thoughtful about employees that have kids that potentially are symptomatic that we wouldn't be screening through our employer processes. And that's something we're actively working on now, is directing them to tools that will help give them some insights about how to respond to early indications of symptoms. Is it an allergy or is it something more serious? And that's something that employees, they value. There's nowhere else to get that information. They don't know where to go. So that's where we can add value. When I think about returning to work, it's another whole area of identifying the processes of entering office spaces and limiting the number of people on elevators and wearing a mask and the deep cleaning that we did, similar to what everybody else is doing. We were quick to get on board with that and make sure we were being compliant. But a piece that we used, and I saw a question in here earlier, was the tracking of our employees that are entering the office, and trying to do 2 things. One, trying to get our hands around determining if we're going to have 100% of the workforce wanting to return on a Monday morning, which is not a situation we want to see. But also tracking to understand how many employees are interacting with each other in the event that somebody has becomes positive. You know, then we have some responsibility of tracking and determining who they've intercepted with. Our IT group came up with just a simple little calendar within our Outlook system. That's an open calendar, and when you are planning to enter our office spaces, you have to log that. And you log when you're going to be, when you're arriving and when you're departing, so that it shows who is in those offices, and the calendar is by floor. So, you know, we have multiple floors in our offices. The calendar is set up by floor. It documents who was in there during the times, and then we have a history. So that, you know, if we have a contact tracing request, it's pretty easy for us to digitally go back and determine who you intercepted with, and you can see that. You know, it's not supposed to be a secret. These employees, we want them to have some comfort too, and that seems to have been working pretty well. And you know, I said earlier we have about 10% of our workforce. It seems like they're in the office at any one time. We really haven't had to ask people to defer and not come in until later in the day or come in tomorrow. It's really never been above that. But with this simple little calendar, it allows us to see, you know, proactively what that occupancy level is going to look like, and that's worked great for us.
Great. And Jackie, in addition to kind of the weekly emails with Jackie or the Friday emails, how have you been supporting your workforce remote and also in the office?
Pretty much in all the same ways that that Sean and Louise have mentioned. You know, promoting the EAP resources from medical carriers, people in the office. It's really about them feeling safe. So, you know, we went overboard to make sure we had plenty of PPE and sanitizer and everything available. And then also, Sean, through the returning to the office plans that each office has, we have a different, on our intranet, each office has their own localized intranet page, and so we posted the individual plans on each page, and also we've got a calendar facility on each of those, and so people put one in the office and we monitor that. The only time that we've seen capacity tends to be like on a Monday or a Tuesday if we've got new hires starting and then a flurry of people want to come in and do onboarding, and sometimes there we've had to say, okay, you need to be in the office, some of you other people, can you stay out or can you stagger it more during the week? But that's probably all I have to add there, Sandy.
Fantastic. So now kind of looking towards the future, before we get to Q&A, I mean, you've all mentioned it in some way, this new normal, this new kind of transition that we've had to go through. So Jackie, I mean, I'd love to start with you. What does kind of the new normal look like? What are your major concerns as you look to the future, near future, long-term future, kind of in the continued handling of coronavirus?
Yeah, and who knows, you know, what that future is going to look like. You know, we all thought it was going to be over by May, and so now I think we stopped really talking about that, and it's like, this is the new normal that we're living in now. So we do expect it to continue to be very remote focused, and we started to have a lot of conversation around, will we be totally remote in the future, or will we be some kind of hybrid blend? And we definitely think it'll be a hybrid blend. It's very easy to say, yeah, 5 months in, everybody's working really great remotely. But of course, most of the population have built their relationships, have understood the culture through being in an office, through building those face-to-face relationships. So we have a major concern that the longer that people are out, that those connections will maybe decrease. And so how do we keep those strong? So we definitely think that we will have a hybrid. We've identified that probably most of our roles can work remotely, but as we've seen, not everybody has the home environment, either from physical space, their own ability and desire to work in the home, or through having to juggle with childcare arrangements. Not everybody wants to work from home, and so how do we find a combination where we give people an option to do what works best for them as well as what works for the organization? We know that it's going to require us to operate quite differently, be a lot more intentional about, say, writing down processes, deploy different technology, look at what that means for the fixed costs we've got of all of the office infrastructures that we have. So we are having conversation internally, and we're deliberately not rushing at anything like that, so that we are able to have a full debate before making any decisions.
Great. And we'll go right down. Sean, what does new normal look like for PotlatchDeltic?
Well, I think Jackie kind of nailed it. We really have no idea what the future holds. And, you know, I think working remotely will have presence in our future permanently. I don't know what the prevalence of that looks like yet, but it was a lot more than I would have guessed a year ago. I would have guessed that it was probably 0 or something close to that a year ago. So it looks a lot different for us. I think the two things that I'm struggling with right now when I think about the future and that remote working, first is the onboarding of new hires and getting them incorporated into the culture of the company when they're working from their house, and their engagement in the office is either low or 0. You know, they can be productive in their division, but they miss a very valuable component of the company when they're working in that when they're working under those circumstances. So I'm struggling with that. And I think the second piece that I'm struggling with when I think about remote is what is the employer responsible for in providing them a remote workspace? It's easy to provide the laptop and monitors. That's not expensive. You know, we can handle the printing and ink and paper. That's not what I'm talking about. What I'm worried about is how do I ensure that they have a productive workspace? You know, I think about an office chair. Are we responsible for that? A stand-up desk or an adequate sit-down desk that's ergonomically correct? And I think about the implications if we don't provide that. What kind of workers' comp liability are we looking at down the future, down the line? Those are the things that are worrying me right now. But I don't know what that's going to look like. Maybe it'll fix itself, and we'll get this vaccine, and everybody will want to be back in the office. But I'm skeptical, and our employees are excited to be able to work from home. They love the work-life balance. Many of them would describe that this is a value add for them. So those are some of the questions that are kind of playing on my mind right now.
I appreciate kind of how honest you are with the questions and challenges that you're putting on, because I know so many people here probably are thinking the exact same thing, Sean. And Louise, just to end us before we get into the Q&A, what does the future hold? How are you thinking about the new normal?
Yeah, so it's a really interesting question. I think we have moved as an organization to a phase of coexisting with COVID, and I'll just give you my personal take, which is that I think we're going to be in this situation until at least 2022 in some degree. We're going to have spikes. I don't know if we'll call it waves, but we're going to have different spikes in different places around the country. Even if we get a vaccine, the vaccine may only be 50% effective or less, may need to take more than one dose. A lot of people won't take it. So we're still, until we get to herd immunity, which basically means there's so many people immune in the population that the virus will no longer replicate throughout the population. Until we get there, either through a vaccine or naturally, and naturally is a lot more painful because we're going to have people get very sick and die, but we're going to be in this state. So I really think it's going to be at least, even if we get a vaccine next year, until sometime 2022 or maybe even later until we get herd immunity. So we're really thinking in the long term here, not just the next few months anymore. I mean, I think back in March people thought, oh, this is just a couple months and we're going to be done with it. So as we look at our business and at our teammates, we also are thinking, as I think Jackie mentioned, that we're probably going to go to more of a hybrid model. I mean, our culture is such that we're never going to go 100% remote. But I think, as Sean said, a lot of people like the idea of remote and of more flexibility. So there'll be some kind of a hybrid there eventually. And what that mix will look like, we're not really sure at this point. We do have a future of work task force that is cross-functional, that is working on all of these issues and trying to figure out where we'll be going with them. I apologize, I think my video just stopped, trying to get it started again while I'm talking. But anyway, a few more things in terms of where are we going. Some of the things that we're trying to do is to really figure out what's going to happen with childcare, and we're actually doing an RFI to the marketplace for childcare and tutoring resources, both for our own teammates and our clients, because we feel like this is something that's really going to help support people as we look at the rest of the pandemic here. And I think it's as well work from home for people that are struggling with it now. If the schools do reopen, then it will definitely become much more of a perk. Other things that we think will happen, as Sean said, healthcare has become much more virtual, and we expect that to very much continue. So that's something that we're looking at in terms of how will that play into our population health strategy, and what kinds of resources will we provide in terms of virtual. I mean, right now we've extended telemedicine to our whole population, whether they are covered by our insurance or not, and we've also extended telemedicine to behavioral health. So, those kinds of changes are part of our adaptation to the pandemic. So our first major concern is our teammates and their health and their families, and the second major concern obviously is our business and selling and maintaining relationships, because our business is very much relationship driven in a virtual environment. So we've been developing a lot of strategies and doing a lot of training and trying to help and support people, as well as looking at our travel policies, at least for local meetings, and trying to help people make those meetings safer if they are going to in-person meetings. A lot of clients don't want to have in-person meetings now, but if they're
Thank you so much,
if they do want to have them, we put a lot of controls
and those
in place.
are kind of the main topics for this discussion, but we'll be moving over into a brief period of Q&A that'll be moderated by Amy.
We're working on it and we're maintaining flexibility.
Yeah, thank you so much, Sandy, and thank you everyone for sharing so much great information. I've learned a lot. I've been taking notes furiously during your discussion. So I think our audience are very, very engaged. They're not only sharing questions, but also sharing tips with each other about return to workplace strategies. I think on behalf of the audience, I have a question to you, Sandy. It's about the technology that in response to the new normal, the non-COVID symptoms. Does Bowie Health have any technology that can help with non-COVID symptoms as we sort of transition into the new normal?
And thank you, whoever asked this question. Bowie has really been in the business kind of pre-COVID and will be in the business post-COVID of helping people understand what to do when they're feeling unwell, when they have a new symptom or they don't know exactly what to do with a symptom that doesn't go away. And that can range, again, remembering the time before, anywhere from like your back pain, your leg pain, maybe some kind of aggravated stomach pain. And Bowie has built technology, one, just in terms of kind of that immediate step, but then also being able to help someone navigate to the care that's in network for them based on their employer. So as we look into the future, kind of to ask myself, what does the new normal look like? I think even as I've spoken with the panelists, that we're all very much aware of the fact that right now people may not be seeking care because they're afraid of going into hospitals, because they're afraid of going into in-person care. And what does that mean for 6 months from now when we're going to be seeing upticks, given the fact that people weren't getting potentially the preventative care that they should have been, or the routine care that they normally would have gone to see their PCP. So Bowie is already anticipating that as we kind of, one, move forward with our existing technology, but build for the future, knowing that we may go through COVID, but what happens after COVID when breast cancer screenings have been low during this period? How do we support people in those types of instances? Which is to say that we have the core technology and we're really kind of looking forward to that future where we can help people outside of coronavirus for everything else that may be affecting them.
Thank you so much, Sandy. And I think audience are really interested about the productivity of especially the remote workers during this pandemic. I think Sean mentioned earlier that most of the employees see there is an uptick in productivity of your workforce. So I also see another question which is related to productivity is around the innovation, also the collaboration across different employees while they're working virtually, and how to sort of foster the spontaneous interactions while everyone is working remotely. So I wonder if any of the speakers has any tips to share about how to foster collaboration in this remote environment.
Yeah, you know, I don't have a great response to this. I think for the productivity for us, where we saw most of a big portion of the gains were in our accounting group. It's hard to measure that productivity, and if somebody's got a great idea to do that, please share with me, because I would love to be able to take that back to our leadership team. But for the accounting group, you know, it's the same. It's similar processes every month end and quarter end, and what we saw was that we had the capacity to get a lot more done at the end of these quarter ends, where normally these deadlines were, you know, they've got scheduled quarterly closes and SEC filings that are due on a tight time frame. All of a sudden, they've got the capacity to take that on, and you know, in examples for us was that some of the annual audit work that gets pushed into the fourth quarter, they're already getting some of that tackled. In fact, I think half of it's already been tackled, and we're in August. Those type of examples are really what we've been leaning on and pointing to and saying, wow, we didn't add any more staff, and we're tackling all this additional work, and we're still in the middle of the year. And so we've been relying on those kind of examples.
Great, thank you so much, Sean. And Sandy, do you have anything else to share with the audience about Bowie House, or if anyone have any questions, can they reach out to you and the speakers for questions?
Yeah, one, I just wanted to take some time to thank Jackie, Sean, Louise for taking the time just to walk us through how you've been approaching reopening, how you've really kind of thought about maintaining that employee trust. You're navigating some crazy waters, especially since the three of you are across the U.S. So in terms of your areas of focus, many of you are balancing multiple states and trying to figure out how do you keep your offices reopened amidst different state guidelines. So I just wanted to, one, thank you for taking the time, because I know that work is not stopping during this hour that you've taken with us, and we really appreciate just your honesty, your transparency as you've navigated, and even just looking at people's questions and responses. I think people got a lot out of it. What I wanted to just take the last minute here to say is I've been really lucky to be able to work with Jackie specifically, but members of my team working with Louise and Sean as they've used Bowie to kind of go through this process of reopening. And I think what we've all internalized is that there's so much to learn, and we're really trying to aggregate as much of that to help make this process as smooth as possible. So if you have any questions, if you just want to kind of hear what other employers are doing, if you just want to talk, my email's here. I'm here to connect, and yeah, we're just looking to see how we can make this process as easy as possible. So thank you again. Amy, I'll hand it back over to you. But this has been fantastic.
Yeah, I just want to echo Sandy. This is a brilliant webcast, a lot of great information. I see that our audience find today's information very helpful as well. So with the next 2 minutes we have left, I'd like to use the time to share a little bit about the upcoming TCB research initiatives and some events. So very timely and relevant that we have a survey. The topic is around reopening the workplace. It will be launched tomorrow. It's a really short survey with only 3 questions, and by completing survey, you will be able to receive a summary of the results when they are released. So please look for the survey link in a follow-up email to the webcast tomorrow. And I'd also like to mention that we have a virtual event in September. It's the IBI Conference Board House and Productivity Forum. And for TCB members, the event is free. And for non-members, you can use the code KN1 to save $150 for registering this event. And we also have another special webcast. It's in late August, and the topic is around the business case for family forming benefits. If you are interested, please register through the link on the website. And last but not least, if you are interested in collaborating with the conference board to host another great program like what we saw today, please reach out to us. And I'd like to thank everyone, all the speakers and audience again for joining us today. And we look forward to seeing you in the future. Thanks.